Teeth that are healthy and function well actually usually look pretty good, but that's not necessarily the case. Either teeth can be relatively healthy and the patient's not particularly satisfied with the way things look, or sometimes teeth look okay but they're masking problems underneath. But for the patient that is relatively comfortable, maybe teeth aren't broken, they're not painful, and maybe there's really not active disease, maybe they're just worn or they're discolored, and the patient's not pleased with the way things look. We always start in the same place because sometimes things can actually be simpler than we might think. And that's gathering as much information as possible, figuring out, okay, well, if teeth were the right shape or teeth were in the right position, where would they be? And then a lot of times that lets us be simpler. Maybe things that we thought were the patient needed all of their upper teeth redone, maybe it's just like the front four, and that fixes what the patient wants to accomplish. So first things first, we just capture the information that we need to capture to make sure that we're treating the patient appropriately, but also not over-treating. But in general, usually you're thinking of things like maybe it's just whitening, maybe it's orthodontics, so that we're actually moving teeth into the right position. If a patient's lost structure, then we need to regain that structure, usually with something like a veneer or crown. But it all starts with diagnosis and gathering as much information as possible, make sure that we're actually accomplishing a plan that's going to accomplish the patient's goals.